Good day, good people. Welcome again to another episode of Deep Dive with Tranquility. I'm your host, your boy Umanda Wagambata, Ushando Undabezit. Today we have our special guest, Katlego Rafapa, an intern clinical psychologist. Kechi, how are you?
I'm good, and thank you for having me.
It's a pleasure, Putonku. So, today we're going to discuss some of the issues which I think your knowledge will be very helpful, not to us, but most importantly to our viewers.
Okay.
Let's start by saying, can you please introduce yourself to our viewers? Tell us who Katlego is and what is it that you do.
Okay, so as Umanda explained, my name is Katlego Rafapa. I was born and bred in the Limpopo province. Right. However, my profession is as an intern clinical psychologist. What this in summary means is that I completed my master's, right? And then I also completed an internship. Specifically, I completed it at Dr. George Mukari Academic Hospital. So basically, that's what it means.
Okay, maybe just to enlighten us, what is it that our intern clinical psychologists do?
Okay, so they do the same thing that a clinical psychologist does.
Okay.
The only difference is that they have a supervisor who's a qualified psychologist.
Right.
So what they basically deal with is any clinical symptoms, right, that can affect a person's either behavior, emotions, right, or the way that they interact or relate to other people, right? Which in summary or in general, it's called mental disorders.
Okay.
Right? So the reason that intern clinical psychologists need to be supervised by a clinical psychologist is because technically they're still under training.
Right.
And then they still need some advice in terms of number one, their diagnoses, and number two, in terms of whatever treatment plan might come about after they've diagnosed. So what will normally happen in that process is that they'll see a patient, and then after that, they'll make a diagnosis, have a treatment plan, then present it to the supervisor.
Right.
And then so the supervisor will give some input in terms of just guiding the intern.
Oh, quite interesting. Okay, let's get into it.
Okay.
So, with our communities, right? Yes. People still don't understand, for example, most parents or people in general don't understand certain behaviors that we see in our kids, right? Okay. So it would all be taken and they would all be narrowed down to maybe it's just a silly act. Mm-hmm. And I know with us black people will be more of because they don't actually get to understand. So can you explain broadly what do mental health experts mean when they diagnose a client with things like conduct disorder?
Okay, so just to begin with, I do agree with your first thought pattern that in some instances it is normal behavior that can be defined as naughty behavior. Okay. So I'll give an example. It's normal for kids between the ages of around 2 and 3. It's called the terrible 2s. Right. And the terrible 3s. It's normal for them to act out in outbursts, so emotional outbursts, right? Your tantrums. Sometimes they even become a bit aggressive towards adults. There's a reason behind that. Remember, the child just went through the infancy stage, mm-hmm. where they were completely dependent on their parent. Mm-hmm. I mean, they were crawling, they couldn't even mm-hmm. walk. Once they start developing walking, for example, and once they start exploring the world, they want to be more independent. But what happens with parents? They try and overprotect them or smother them. Mm-hmm. Then the child will act out. In that instance, it's normal. Right, that behavior. And I'll also give another example. During the adolescent stage, right, kids are trying to find a sense of themselves. Mm-hmm. Part of finding a sense of themselves is finding some sense of their own identity outside of their family. Right. So let's say you're a second-born child, and to your family, you're the naughty one compared to your siblings, right? That's your identity inside your family. Now you start exploring what is your identity outside of your family. Then what happens is you start coming together with your peer group, right? Mm. In that peer group, there might be, for example, experimentation in terms of alcohol. That's normal. Right? And it is part of developing your sense of self. Sure. But it from the parent's perspective, that can be viewed as naughty behavior. Mm-hmm. And it is fine and it's normal. It is part of the developmental process of a child, right? Now, the difference with when it is a conduct disorder, there's two primary things. We look at whether they're aggressive towards people or animals, number one. That aggression can be shown in terms of, for example, they might physically fight with a lot of people. And not just one person. And that's also very important. See, if a child, for example, doesn't get along with their siblings and they get into physical fights, but it's not like really extreme physical fights, right? That's normal if it's just a sibling. But if they find that the child is getting into multiple physical fights with different types of people, right? That's the first sign that it might be a conduct disorder.
So that also can start at that early age when you spoke of terrible twos. They could also show that aggression in that early age or as they, getting old.
So with most mental disorders, right, it's much more safer to diagnose from around 6 and 7 years old upwards, right? So the specific criteria in terms of age for a conduct disorder, you can diagnose conduct disorder at 15 years and below. But that means from around 7 years to 15 years. You can also diagnose from 15 years up until 18 years. Okay, does that answer your question? And just on that point, what I'd also like to add is that the reason that at around 6 and 7 years old is when we start diagnosing is because prior to that, most of the disruptive behavior that you see, the hyperactivity that you see from kids is part of their normal development. Specifically what I mentioned earlier, that they're just trying to get a sense of independence at that age. But starting from around 6 years old, they should start then getting some sense of structure because they're also starting to go to crèche, all of those things. Okay. So they should be getting some sense of structure. Okay. So if they're struggling in that transition, from that exploratory phase into where now they need some sort of structure, then that's when we can start diagnosing, besides conduct disorder, other mental disorders.
Okay, so it doesn't necessarily mean that the child should have developed their own personality before you diagnose.
No. So which is why with conduct disorder, and the word conduct is very important, it's not a personality disorder. Okay. The reason for that is because we also consider the fact that the personality is still developing, right? So we are, and if you look at some of the diagnostic criteria or some of the behaviors that we look for to diagnose, right? We term them behaviors instead of personality traits, right? So I'll give an example with what I was describing. I described aggression towards animals or other people. That is overt behavior, right? Number one. Number two, deceit and theft, right? They'll steal and they'll lie a lot. That is overt behavior, a behavior that you can actually perceive or see, right? And then in some instances, you also find that they will destroy property. And you'll find, for example, they will set a lot of fires around the house. In worst scenarios, there have been cases where they've even set fire to whole buildings. So there you can see that we're looking more at their behavior because we acknowledge the fact that they haven't as yet developed a constant personality structure. Which, with that, it only starts developing around 18.
Wow, that's quite interesting. And I think most of our viewers also have their own questions, but quite interesting. So can you please maybe just try to list some of the personality traits, or characteristics that parents should look out for, in terms of to their young ones?
Okay. So, in addition to the ones that I described previously, which is destruction of property, right, aggression towards other people, and the third one was deceit and theft, right? You also find that, as I mentioned, they violate other people's rights. So no matter how much you describe to the child that, no, like, respect your brother, don't steal his toys, they'll continue to violate those rights, right? Number one, that's additional to the core ones that I just explained. Number two, and now I'm describing how they perceive the world, right, which will explain some of their behaviors. They have a tendency to see other people's behavior to have negative intentions towards them, right? So I'll give you an example. If you show them empathy and love, in their warped perception of your behavior, they might think that you're trying to trick them into something, that it rationalizes their aggressive behavior towards you. So they misperceive other people's behaviors, right?
Okay.
Number 2. Also, what's also very important is that they struggle to control their own emotions.
And then probably maybe that's why you find most of them, they are always on a defensive mode or attacking mode, they're never neutral.
Exactly. And we'll get into more detail when we start discussing some of the treatment techniques that can be used. So, as I explained, it's not that they are intentionally trying to fight or aggravate other people.
I think that's very important because I think most people don't understand. They think, oh, these kids are doing it intentionally, that's why they will label them as silly and rebellious. So I think that's what most viewers need to understand, that it's not intentional.
And as I described, so there's 2 things that you can look at in terms of whether it's intentional. Number 1, we need to acknowledge the fact that their personality structure hasn't developed yet. So they are still developing, right? We can even look at our own laws, right? When do we start holding children accountable? From around the age of 16 upwards.
Right.
So we acknowledge that they're still developing. We can't blame them for every single thing that they do. That's number 1. Number 2, when I describe that they can't control their behavior, their emotions, it means that it's not intentional. Immediately when they feel angry, there is an inability to actually control that anger. Then that leads to outbursts.
I'm actually tempted to ask you this. So you find old people, right, whom I would perceive as they fully developed their personality, but they would engage in things like dog fights.
Yes.
You know, and how do you describe, how do you, is there a problem? Is there a problem with their personality, or is there a problem with their surroundings or their condition? Because for me, it doesn't really make sense. I mean, you spoke of aggression to property, right? Aggression to other people, and probably I would think animals. So what has to do with finding older people, or even the young ones, engaging in such activities?
Okay. So, as I mentioned, just to begin with, is that conduct disorder can be diagnosed up until a certain point. That certain point is around 17 years old.
Okay.
Right? According to number 1, psychological theories, multiple ones, more than one, and number 2, actual neuropsychology research, the personality structure starts emerging at around 18 years old. Right? So what happens is someone who has an initial conduct disorder that's not effectively dealt with, that behavior will then form part of their personality structure. Then they start having what's called antisocial personality traits. Now that's a personality disorder. It's no longer a behavioral problem.
It's a personality
disorder because they are 18 and older. Because the personality structure is then starting to form.
Okay.
Yeah.
So, KG, just to have a clear understanding, maybe if you can take it back to say, how do you describe the personality? What is the personality? So that you could get to understand, how do you describe the personality? When somebody says, what is personality?
Okay. It has two elements. It has overt behavior. So what we see as people who interact with you gives us some sense of what your personality is. So I'll give an example. Why would we say someone is kind as part of their personality? Is if they overtly display kind behaviors towards others.
Correct.
So number 1, what we can see is the behavior. That gives some indication of what their personality is made up of.
Wow.
And so that's the first thing. Number 2, it also needs to be across different contexts. So the person needs to display those same characteristics, as they call them. Psychologists prefer using personality traits. Right. They must, for example, display them at school, number 1, and also display them at work, number 2, if they are working, and they must also display them at home. So there you see that there is an actual consistent personality structure that you see across different contexts. So that I would define as personality. Okay,
so moving on to the next question. As you mentioned, that the consistent pattern of conduct disorder, is the violation of rights of others,
Yes.
right? And so, for example, damage to theft, damage or theft, or of property, physical aggression, etc. Would you describe these types of behaviors as intentional?
Okay, so I would, based on my own professional opinion, would say that it is not intentional, primarily for two reasons. The fact that their personality, with specifically conduct disorder, not antisocial personality. With conduct disorder, their personality is still developing, right? And underlying what you see, meaning the behavior, is a lack of control of their emotions, number one. And what we also need to understand, people with conduct disorders also, compared to other people, experience a lot of negative emotions. So your anxiety, your depression. So that overt aggressive behavior is them trying to also escape away from their own internal state. And because they're kids, right? Because we consider them minors since they're 15 years and younger, right? They don't know any effective way of dealing with these uncomfortable feelings. So then they lash out in that way.
So I'm thinking now of kids, those young kids, when they get angry, they start bashing their head against the wall, they start damaging things. Is it the direct result of, the emotions? Or is it the disorder? Is it personality traits? What is it?
So it is a direct, it is directly caused by the internal states. So in most instances, with children, they display what's called externalized behaviors. Externalized behaviors, simply explained, is you show you how you're feeling inside through your behaviors outside. So I'll give an example just to show the difference between kids and with adults. So an adult can wake up today and not feel like going to work. But despite that, they will get up, shower, and come to work. A kid who has to go to preschool and doesn't feel like going to preschool, they will protest to the parent that I don't want to go to school. Right? So that's a way of them expressing their internal state. So in that instance that you just described now, there is some uncomfortable feeling, right, that the child is trying to express. Unfortunately, they're expressing it in an ineffective way by banging their heads. Specifically with that one, we see it a lot with autistic kids, especially those who struggle with speech, because they're even more, for lack of a better word, are unable to express themselves. Number one, because they're kids. Number two, they also have speech problems. Now, what's the only way to express themselves? They get frustrated. So, then, as a way of soothing themselves, they externalize the internal pain into physical pain by banging their heads.
So, through their behavior, they're actually asking for help.
Exactly.
Wow. Okay, so apart from the symptoms you have mentioned earlier, right? What other characteristics would you assess when diagnosing a client with a conduct disorder?
Okay, some other aspects that I would check is maybe if it's not another disorder. I'll just give one example. One that mostly is confused with conduct disorder, particularly because they fall around the same age range, right? From around 6 years up until around 15, where you see the symptoms more, is ADHD, right? And the main difference between ADHD and conduct disorder is that with ADHD, both a person with conduct and ADHD disrupts their environment.
Okay.
So whenever they are there, attention is on them because they're very disruptive. But with the one who has a conduct disorder, it's mostly because they're fighting with other people and they're violating other people's rights. Right? Those two things. With a person who has ADHD, it's because they're hyperactive.
Okay.
But they're not necessarily fighting with anyone. What they might run around, disturb the class and all of that. But they won't actually get into either physical or aggravated instances with another child. So number one, I would check whether it may possibly be another mental disorder. With the example that I gave, it might be ADHD. In some instances, it might be what's called an adjustment disorder, especially with kids. So an adjustment disorder is basically this. When a child, for example, moves into a new school, let's just give that example, right? Now they feel frustrated, they don't have friends and all of that. They might then start acting out. And again, going back to what we discussed, the internal state, they feel uncomfortable,
right,
and the emotions are uncomfortable, right? They can't really express themselves in an effective way. Then they start acting out. So it might also be an adjustment disorder. But again, the main difference between an adjustment and conduct disorder is that with conduct, it's more violent, meaning they get into physical fights. Number two, they violate other people's rights, right? So just going back on my point, I would differentiate it from a possible other mental disorder. Number two, I would also differentiate it from another medical condition. I'll give just two examples. There is what we call temporal lobe epilepsy, right? Now, you must remember our temporal lobe is partly, along with the amygdala, it's partly responsible for how we control our emotions,
okay,
right? So if you have epilepsy around that brain area and it causes some dysfunction, that means that you won't be able to control your emotions, right? So you will have those emotional outbursts, right? But remember, in that instance, what must be treated is the medical condition. It's not a conduct disorder. It's because there's an underlying physiological and biochemical dysfunction, right? So in that instance, as an example. Number two, the neurodegenerative disorder called Alzheimer's. You find that old people who get diagnosed with Alzheimer's will display some aggressive behaviors to multiple people besides their family members,
right,
that might be mistaken for a conduct disorder. Again, we need to establish whether there is a physiological basis for the way that they're acting, right? So I would, number two, apart from differentiating it from a mental disorder, I would also differentiate it from a medical condition. And then, thirdly and lastly, I would also look into other behaviors. So I'll give an example. Often you find that children who do have conduct disorder, right, will engage in substance abuse.
okay,
So you also need to consider that. Number two, because it's mainly based on the initial interactions, what we call primary caregivers. Right? Primary caregivers are the initial people who raise the child before the child went out into society, right? If that structure, right, produces some trauma between the primary caregiver and the child, just to give a concrete example, let's say a mother and a father who are raising a child, right? In the early beginnings of that relationship, so the relationship between them and the child, there's some disruption between their relationship and the child, right? That might later on develop a conduct disorder. So conduct disorder is attached to how a child is raised, number one, and how they relate to their parents. Because remember, how we relate to our immediate family, that's a map of how we're going to relate to other people. So if our family frustrates us and we need to constantly fight with them, we internalize that map, and then when we go out into the world, we start behaving in a similar way. So just to get a sense of that, what I would also emphasize a lot, especially with conduct disorder, is you need a history, especially a history of how the child's relationship is with their primary caregivers. So those are some of the other things.
So when you speak of a conduct disorder, it's not something that all these people are born with.
No. So it's multifaceted.
Yeah.
So there is a genetic factor. So the primary genetic factor is that we have what's called different temperaments, right? A temperament is basically your emotional state. Remember I mentioned that they can control their emotions. So there are kids who are better able to control their emotions, right, in comparison to someone with conduct. And there is a genetic basis for that. So there's actual genes that they can identify.
Oh, so it's hereditary at some point.
No. So it's multifaceted. It's both genetic, right?
Okay.
Right? But also you need the environment to trigger those genes.
Wow.
That whole process is called, it's what's called epigenetic effect. So as much as you might have the gene, is not necessarily that it's going to be triggered.
So it needs dormant.
Yeah, it's dormant.
It needs to trigger.
It needs to trigger, and in most instances, it would be the environment where you grew up and that initial relationship between you and your primary caregivers. And just on primary caregiver, caregiver doesn't necessarily, and this is, I think, a very important point, especially when we are going to start talking up in terms of treatment, right? Primary caregiver doesn't necessarily mean a mother and a father.
Yeah.
Right? It means whoever is responsible for the daily care and daily needs of the child. And when I mean daily care, I mean basic needs, your housing, right, your food, right? But I also mean emotional care, because that's also needed, right? So if that is not met effectively, and already the child is genetically predisposed to a violent temperament, then that might then be triggered.
So is it possible, KG, that like we spoke, it says some disorders are dormant, right? You find the environment at home is quite nice.
Yes.
Then the child needs to go to school, and that's where the bullying starts. Would that trigger something? Would you agree that bullying, and because also the school is an environment, and we spend most of our 8 hours around those people, so that also can cause a mental disorder.
Yes, so that's a very important point. So as much as there is a great emphasis on the primary caregiver or the initial relationship that a child develops with the primary caregiver, but we need to also place importance into the type of community or society that the child is walking into once they get released into the world, right? And in most instances, it's school. Right? Because when a child is growing up, they will grow up in the household. Yes, they'll go out and play, but normally they don't play too far away from the house. When they start traveling a bit further from the house, in normal instances, it's most probably firstly the school. Right? So, as much as a child, just to answer your question, might have a stable, right, and supportive relationship with their primary caregiver, it's also important to consider how their initial relationship is with the outside world. And the initial relationship with the outside world develops at school. And I'll just give another concrete example. They find that kids with ADHD, not a huge majority of them, but there's around a quarter of them get also diagnosed with conduct disorder. There's a theory of how it explains how that happens. So, the child has ADHD, he's extremely hyperactive, he's a handful for his parents, right? Let's say, in a good scenario, the parents are able to soothe him, they're able to handle his behavior effectively. Then, they send the child to a normal school, where they're not equipped to deal with hyperactivity, right? The child gets to the school, acts in the same way that they act at home. Then the teachers then react to him negatively. They start punishing him. They start swearing at him.
Another trigger.
Right? Because remember, already he's predisposed to that temperament, right? What then it might happen is that then that might trigger that genetic predisposition of his temperament, because now he's exposed to a hostile environment. Right? Yeah. So just to answer your question, it is possible. So, which we can bring in maybe the African view, that it's actually true that a child is raised by a community, not just their parents.
Wow. And what role does environment, and I think you said a bit about this, but you can elaborate. You say, what role does the environment and the culture play in relation to a specific illness?
Okay, so as I explained, the environment is very important because it forms part of what the child internalizes as normal behavior, or how to deal with the environment, right? And I gave 2 examples of how the primary caregivers are very important in terms of that, but also their first initial contact with the outside world, which in most instances is the school and their peers that they find there, right? So that's the environmental. When it comes to the cultural side, right, I think it's very important just to start broadly. And again, this is not a universal definition of what culture is, right? So in my own definition, it would be that culture is shared beliefs that lead to certain practices, right? And if we're looking at a definition of what culture is in that manner, right? We get Xhosa culture, right? We get Zulu culture, we get Spedi culture or Pedi culture, we get Tswana culture, right? Gang culture.
Gang culture.
Gang culture has certain beliefs. They believe that in a hierarchy, like there's the captain, there's whoever, right? And there's a way that we carry ourselves.
Definitely.
Right? And there's certain things that need to happen. So once we have these beliefs, right, then we have our own practices. And I'll just give an example without naming specific gangs. So there is a certain belief in prison gang culture. Now I'm describing it as a culture. That if certain things happen, then blood needs to flow. And that blood needs to flow from prison wardens, for example, right? So there you have a belief that blood needs to flow if something happens. And then you have a practice that then we stab wardens, right? But look at that behavior. What does that behavior include? It includes violating other people's rights. You're violating the warden's rights. Right? Number two, it also shows aggression towards the wardeners. Right? It also shows a lack, to some degree, of emotional control, specifically around the gang, because they have this belief that if you piss us off by doing something, then we're going to retaliate. So there you can see some conduct traits, right? So diagnostically, we might consider that as maybe possibly antisocial behavior or a conduct disorder. But that is contained or normalized within a culture. And the culture is gang culture. I'll give another example, away from like prisons, right? In around, I think, 33 African countries and also the Middle East and Asia, they practice what's called female genitalia mutilation as part of their culture. So they have a certain belief that when a woman reaches a certain age, right, the external organ, sexual organ, needs to be cut in a particular way. It's a belief, right? And it influences their practice. So there's action behind it, right? But if we looked at it, according to the UN, in fact, they said that it's a violation of another person's rights. Right? So there again you see culture. Moving back closer to home, Uktwasa, which is practiced in the Eastern Cape. Uktwala rather. Uktwala is they steal a minor from her family in most instances, because in most instances it's a female. In fact, I think in all instances it's a female. They steal a minor, meaning someone who's below 16, from their family, with the intent of bringing back that girl child into another family and then paying lobola. So the process that I'm describing is basically forced marriage. And it's a cultural practice that's still practiced up until today. And we've had a lot of instances even within this decade, right? But that's normalized within a certain particular culture. But it violates someone else's rights, right? And it aggravates other people. So there you see that culture does have some influence, and it's very controversial because remember, some might argue that no, and they also have a right, since we live in a world where beliefs are equal to a certain degree. Some person who's cultural might say no, but in my tradition, Uktwala is part of our practices. And I don't feel like I'm violating anyone's rights as much as the child is screaming, but they know that this is part of our culture, right? And they might argue that the DSM, which is the main text where we get our diagnosis, comes from the Western world. So they are infringing on our cultural practices.
So we spoke that most of these people with these conduct disorders, right? Most of the time they will do things not intentionally so.
Yes.
Right? So do you believe that punishment they will always need to be met by punishment? I mean, if really they don't understand themselves, and they don't know what's going on with themselves, then do you think it should be met by punishment?
So I think therapeutically, right? If we had to distinguish, if it's intentional behavior, intentional, not a contact disorder, because we've established that with conduct, there's other underlying thing that is influencing the person, right?
Yeah.
So if it's intentional, then in that instance, there does need to be some form of consequence, right? But you balance that with rehabilitation, right? So as much as you are punishing, but you are also offering better skills to that person when it's intentional, right? But now, when it's a conduct disorder, right? It used to be the same. So they used to treat the two similar. Between whether it's intentional or a conduct disorder, there used to be a consequence, right, to try and make that person refrain from that behavior, but they'd also equip them with skills. But therapy has moved from that, right? There's less emphasis on consequences in a conduct disorder. What there is there's an establishment of rules. Firstly, because remember, this child doesn't have any structure, let's put it as a structure, or a map of how they must interact with other people, right? Or how they must control their emotions, right? So you give them rules and behavior back. They see it as an appropriate way, right, to react to this type of behavior. And remember, with people with conduct disorders, they think everyone's behavior, there's some cruel intent behind it. Now you're showing them that actually people do have a cruel intent, because I just caused something to make my parent angry, and then what did? They beat me up.
Okay.
It means that people will beat me up.
Okay, so that would take us to the next question to say, what is the best management or remedies for conduct disorder in children? How do you deal with them?
Okay, and again, this is not exhaustive, so this is just my preference in terms of how I would treat it, right? Number one, a support group for those minors. You know, we focus a lot with adult support groups, but we don't really create support groups for kids.
True.
Right? But with kids, what's very important is that the composition of the support group is very important. You can't have kids who are having active symptoms or behaviors of a conduct disorder all together. Because what then might happen is they might influence each other.
Okay.
The best way to go about it, you balance it out. You have kids who had a conduct disorder who went through successful therapy in that group, and then you have kids who are still struggling. Then what happens is they'll mirror the other kids' behavior and how they behave. And you constantly, if you're in the group, for example, you constantly reflect between them. So let's say one is still struggling with the behavior, and then they do something, right? And then you might try and, let them know that, no, but remember our boundaries and rules. And then you might even print it out and put it there. What's rule number 3? If they broke rule number 3. And then they look at it, and then you leave them at that, and then you go to maybe a kid who has started to integrate some of these skills, and then you ask, for example, I'm just giving an example, Timothy, how would you have reacted in that scenario? Because the kid is starting to integrate those skills, they might then explain it. And because it's the same peer group, it also makes the other children to realize that it's possible for them because their peers are also doing it. So support group, number 1. Number 2, I would also do individual therapy. And especially with conduct, I would do individual therapy, meaning on one-on-one basis, right? First, before I do a group, just to stabilize the child and then put them into a group eventually, right? And yeah, that one I won't get into too much detail, but what I prefer is psychodynamic therapy, particularly a technique called counter-transference analysis, where you feel how the child makes you feel as a therapist. So if the child is pissing you off, probably he's pissing other people off. But the only difference is that you don't react how other people react.
Yeah.
That breaks the child's perception.
Okay.
Right? And then that can possibly then turn the way that they then start reacting to other people. Because remember, other people might scold them, might scream at them, but when you remain calm, right, they didn't expect that behavior. And because they'll start mirroring the way that you handle certain situations, then the process is called introjection. Then they might then take that as a new map of how to interact with other people. So that's another way. And then, so I said support groups, individual sessions, and probably I would also involve the parents, which is very important. You mentioned previously what happens when parents don't know how to deal with the child, right? They might worsen the problem. So I would also involve the parents and psychoeducate them in terms of how to handle the child. So those are the three
like you spoke that, we might have group sessions of, kids who are now recovering from these disorders, and I also think it's important that the families also need to support each other. Because definitely would find parents who have been in that state, and the kids are getting better, and they could give courage to the other kids. So I think, it doesn't only affect the kid, but most importantly, parents also should equip themselves with enough information. So, KG, do you think that incarceration is the best solution for this youth development?
General youth development, I would say no. So it's different if we're talking about conduct disorder or general youth development. So firstly, just to start with general youth development, I would prefer rehabilitation instead of incarceration. So the only difference is that with incarceration, you are punishing, right? So you did this behavior, we're sending you to a prison or some form of prison or juvenile detention center. That's what sometimes they call them, right? Remember, you are now punishing the child. But in those, let's be honest, in those type of facilities, kids influence each other. Now you have a bunch of kids who have behavioral problems.
And they are all together.
They're all together. What's going to happen? Right? But if it's more rehabilitative, then that's when you introduce professionals to then assist them. So as much as you are removing them, right, from certain environments and putting them into a facility, but that facility is not a detention center, and it's not a prison. It's a rehabilitation center.
So sorry to cut you. So when they send these kids to incarceration, they are not diagnosed.
In most instances, no. So the reason I'm saying that, and I guess we're touching on another aspect of it. Statistically, it is also factual that most kids who present with these type of behaviors come from low socioeconomic environments. So they don't have access to counselors, they don't have access to therapists, right? So then they display these behaviors, they steal people's things, they set light to people's property, and then what happens? They don't have any diagnosis, is that they are engaging in criminal behavior. And then they take them to a possible detention center. Now, our law says that they have protective frameworks around that. So they don't send someone who's younger than, for example, 18 to an adult prison. They'll send you to a detention center. But remember, we just described, at the detention center, what do you find? Kids with similar behavioral problems.
So by the time they leave there, they haven't changed.
Exactly.
They continue with that.
Which is why diagnosis is important. And access to healthcare professionals is important.
The last question would be, will there be a greater change in human development if, the types of punishments ordered to a client with conduct disorder was a bit less harsh?
No.
Punishment.
No. Remember, so the reason I'm saying that is because it's because I said consequences is the wrong way to go around it. So whether the consequence is less harsh or more harsh, and remember the other thing, we're subjective people. So I might punish a child A, with maybe making them sit at the corner and keep quiet, right? And then punish child B with maybe screaming at them, right? How harsh I'm punishing them, it's up to them, not me. So how am I going to even calculate the intensity of the consequence? Number one.
The level of harshness.
Exactly. Number one. Number two, what I mentioned previously, we should move more towards establishing boundaries and rules, and then rewarding behavior that sticks to those boundaries and rules.
Okay.
rather than punishment.
I would like you, before Sivala and Dukechi, just to talk to the parents, because I feel like they're in a position where, they're also confused.
Yes.
They do not understand. They want to do the right thing, but they find themselves, instead of trying to pull the kids towards them.
It's more the mistakes that you've made earlier. Just as long as it's not too late when the kid has already developed a personality structure.
Wow.
Right? So mistakes might happen during infancy. Mistakes might happen during childhood. Mistakes might still even happen during the early stages of adolescence. But if you establish a relationship during some of that period and correct some of the wrongs or mistakes rather that we've made prior, some good relationship might still develop with the child. So number one, it is okay to not know what to do. Number two, if a parent ever finds themselves in a scenario where they are struggling, there are other professionals that might be able to give some suggestions. And it's not just limited to psychologists, particularly because I know how difficult it is, to get referrals to a psychologist and to even find one in your community. There's also social workers that can assist, right? There's also counselors that can assist. So if you do need that assistance, just try and reach out. And on that point, it's very also important to note that these professionals that I'm describing are in public hospitals. All that's needed is for the parent to ask for that assistance. Parents sometimes, right? And I think it's something that I just need to also reflect on. Parents also sometimes have a tendency of sending kids to hospitals when they're physically sick. My child has a flu, I'll take them to hospital. But they don't know, even if they have behavioral issues, they can still take them to hospital. And then, whatever professional is there, given that they're competent, let's say it's a doctor, and they see that there's nothing physically wrong with this child, the referral process should then take place to refer the child to counselors or therapists.
Ladies and gents, Mama, Baba, Sisi, Abubuti, Nizwe, Rafapa, Kulumile Nati, and what I took Minaputwami from this whole conversation was there's no perfect parent. There's no manual for parenting. That mistakes, that is but we need to learn. And most importantly, as parents, we also need to reach out, ask for help. Just ask for help and not just spoke of it. There's so many professionals that are, disposer, ready to help us. And I love what you said in terms of our behavior. Because I think most parents don't understand what even when there's a relevant issue, it's only right which you can take them to hospital. And like ourselves, which was a trauma professional and we help. Thank you very much.
Okay, thank you for having me.
I appreciate you, Proami, and continue doing your good job.
Thank you.
We're out.